welcome. My name is Scott Sturgeon. I'm with Mariner Wealth Advisors. I work on our practice management team. More or less, our day-to-day job is to help our advisors and folks at the firm make great experiences for clients. And we're hoping and fairly certain that today's webinar will be just one of those great experiences. So as an introduction, welcome. So glad to have you on the call. We're going to keep this relatively informal. We'll kind of go back and forth and discussing a lot of what we think are really relevant topics. As we go along, if you have questions or comments, I would really encourage you to provide that feedback. There should be a chat or a Q&A box on your screen, so go ahead and submit through there is the best route to go. So to get started, again, I'm Scott Sturgeon, and our guest today to kind of unpack what we are tentatively calling kind of the intersection of health and wealth is Dr. Chris Jenson. Chris, so glad to have you on the call today.
Thank you so much, Scott. I welcome the opportunity.
Absolutely. Excited to have you. And Chris, actually, maybe a good way to start, would you mind just kind of giving a little bit of your background just for the audience?
Yeah, I'd be happy to. My background starts, despite being in Big 12 country, I went off to the University of Notre Dame, which is tough to admit, not much of a basketball team, but hanging in with football this year. And when I finished in Notre Dame, I went to med school in Chicago, did my training at Loyola and Northwestern, and practiced emergency medicine for about 13 years. And then got very fortunate, did what every guy hopes to, and then I married up and ended up with a beautiful wife. We have 2 little girls. We reside in the Kansas City area. And I actually transitioned during that big life change as we started a family to consulting and medical advising, as well as some education. And so I currently serve as the Chief Medical Officer for Blue Valley School District, as well as a public health and medical consultant at large around the United States.
Very cool. And you also, correct me if I'm wrong, but you've actually done some work for the CDC. Is that correct?
Yes, I have. So I did a CDC fellowship, which was a great opportunity, and served as a science ambassador. And as you might have predicted, the CDC has been rather busy the last year. And so it was a great opportunity to get that training. I had no idea a pandemic was on the horizon, but I'm grateful that I picked up those skills pre-pandemic.
Very relevant, no question about it.
Yeah, it almost looked like I knew what I was doing, but I assure you I didn't.
Well, for all purposes today, we will certainly pretend like you know exactly what you're talking about, and I'm certain you will. I'm really excited to get this conversation going. Chris and I have kind of chatted back and forth about what we're really going to hone in on today, topic-wise. We've done presentations in the past on kind of that intersection between health and wealth. And we kind of know just in general that there is kind of a positive correlation between those two aspects in life in general. And so what we're hoping today is to kind of touch on 2 general large topics, if you will. The first is really kind of more short-term planning items. And as you might imagine, most of those pertain to kind of the state of where we are today within the pandemic and kind of short-term things that we're kind of thinking about from both a health and wealth perspective. And then also kind of transitioning into more long-term topics. Obviously, we're very hopeful that life will go on and we'll hopefully back to some sort of normalcy in the next year to several years or whatever the time frame may be. So we want to talk through what that kind of looks like, what our thoughts are around that, and hopefully elicit some good feedback from all of you within the process. So Chris, I think just to start, probably the best thing to lead off with is obviously we're in this pandemic. Things are very different than what they once were. Oddly enough, you and I did a podcast for the listening audience. I'll shamelessly plug it. It's called Your Life Simplified. Chris and I sat down for about 45 minutes back in probably March. So when things were starting. And so it's interesting to go back and listen to get perspective on today. But regardless, Chris, I think that the biggest question I wanted to start off with was when you think about the pandemic and that sort of thing, maybe specifically the disease itself, what do you think are probably the biggest risks that people need to be cognizant of? And really, why are people at risk in general?
Yeah, sure. It's amazing how much has been gained over the last few months. But when we first started, think about it, back in March and April, people, including myself, were wiping down Amazon deliveries, scared to pull apples out of the grocery store. We had no idea really how the virus was spread. We just knew that it hung around for a while. And now we've acquired a much better infrastructure of knowledge regarding SARS-CoV-2, the virus that causes this COVID pandemic. And what we've really learned is that it's respiratory spread and that there are certain people who are at a higher risk propensity with the virus. anyone can acquire it through close contact that's unmasked or respiratory in nature. It's just what the virus does to you when you contact it. And so it's a very mystifying disease, really. We see everything from asymptomatic carriers all the way to severe ICU cases that can be fatal. And what we've really learned is that it's not quite this disease that we thought that would only strike the elderly. Rather, although we see it in a higher propensity in older individuals, we've learned that it's a disease that attacks a specific receptor in the body called ACE2. And certain past medical histories or propensities put you at higher risk for the virus to infiltrate that receptor. Things like hypertension, which is high blood pressure, diabetes, chronic lung disease, insufficient blood flow to the heart or cardiac system. And so individuals at any age group that have those propensities or medical risk factors are being struck with moderate to severe cases of COVID, whereas individuals who do not have those comorbidities or problems tend to do rather well with the virus. And so it has been a very interesting, although sad, investigation of what can happen to the human body depending on the risk factors that one possesses.
That's really interesting. I think the challenge too, I have to think, is that, as you mentioned, it's all iterative, right? It's all built on itself. So really, our knowledge base from where we were in March is drastically different than today. And so I think that was some of the issues that have arisen, as people are told one thing and then they change later on. But I think that's just kind of the nature of science and disease. Correct me if I'm wrong.
No, absolutely, it really is. And it was almost a race at times between the scientific community and the media. Who could break the story with reliable information first. And I think that led to a lot of confusion and misunderstandings, and that's unfortunate, obviously, to no one's fault. But science moves at a speed that it can. And as we acquired more information, we would revise guidelines. And at times, I understand why that was frustrating. I get it, even as a clinician and a public health individual. You're working with the best information you have at the time, trying to keep people safe. You find out new information. Now you can either loosen or strengthen those guidelines depending on the new info. And so that has been a fatiguing process. But until there's widespread dissemination of vaccines, it's one that we really need to be resilient about to stay the course, to make sure we all can do our part, even if you think you're low risk, even if you think you have minimal propensity to have a moderate or severe case of COVID. It's easy to identify in one's family, let alone friend group, people around you who would be high risk. And so I always try to think of that when I'm getting fatigued, as I'm doing this and I have a mental image of who it's for. And that has really helped me stay the course.
That's helpful. That is really helpful. So I think one of the questions too we wanted to make sure that we addressed is, obviously there are a lot of people who, like you mentioned, are very directly impacted. Maybe there has been a hospitalization in their family. Maybe they contracted COVID and had experienced symptoms, or maybe very light symptoms, really on probably a full spectrum of that. But I think in general, the fatigue you mentioned, I think, is a very apt description, in that we're roughly 9 months into this whole thing. Things are changing all the time, and life as we know it is obviously a little bit different than it used to be. So when you look at kind of the impact that we're seeing from the pandemic itself, maybe those who aren't necessarily sick, but maybe have just been working from home for 9 months, or in a very small New York apartment for 9 months quarantining, my heart goes out to them.
Yeah.
When you think about those, and maybe there's just a spectrum of individuals, it's hard to kind of categorize exactly how each experience is, but do you have kind of thoughts or things that people could be cognizant of now, to whether it's stay the course or plan in advance for maybe what's to come, or that sort of thing? Any thoughts or things behind that?
Yeah, I think this is one where we can take a tagline from Mariner, is to plan in advance. So you already kind of mentioned it, but think about the situation. So many things are outside our control right now as this evolves. When will the vaccine be out there? How will it be distributed? What order will it be distributed? Who's going to get it first? Will I get COVID before the vaccine hits? All these questions that you really have no control over. But there are things you can do to plan. And this has made a really big impact, particularly on folks with type A personalities. I'll throw myself under the bus. I like to have things managed, and this is sometimes a situation where I can't manage everything. So control what you can control. So let me give you some examples. I'm thinking ahead of time, what would be your plan if you became sick? Who would you go to? Who would take care of you? If you have children, who would watch them? If you have a spouse and they're not sick, how would you deal with that? What happens when both of you are sick? These contingency plans, when you've thought of them ahead of time, kind of remove that pandemonium at the moment things happen. Another thing is just thinking through the logistics of where would I get treatment if I came down with COVID? What's the hospital I prefer? If the bed situation is maxed out there, what's my second choice? Keep in mind, we can't guarantee, depending on what happens in the next few weeks, that ICU beds or even floor beds would be available. And so thinking through your options ahead of time is wise. And then preventative health. Optimizing your physical and mental health in the midst of a pandemic is going to boost your immune system as well as improve your mental health and attitude. And that's not just lip service. I think that's, if it's ever been important, it's right now, and so things like, if you can work in during your day, the realities of taking time outs, taking breaths, eating healthy better than you have before. I will tell you that work from home situations has forced me to go to the refrigerator and plan better meals than I ever would in my office when I barely eat or just grab something as fast as possible. So that's kind of been nice. Exercise has never been more important. If you're curious, exercise boosts the immune system in general with neutrophil counts, and particularly in your lung, we see an increase in macrophages, which are the type of cells that hunt down viruses. And then getting plenty of sleep, which is hard because there's so many stressors right now. But if you're able to work that in, hey, a lot of you lost your commute, take advantage of it. Spend a little more time unconscious and getting some rest. Taking care of the emotional health is also particularly important. One thing that I would say is a lot of your listeners want to be well informed, and they research the media and they look at articles and they read and review, and that's a great way to navigate life. But sometimes taking a break from pandemic news, it's going to be there when you come back. And if it's something that's adding a lot of anxiety to your life or making your workday harder, take a few days off. There's never been a better time to have a social media holiday, I can assure you, particularly around the election. There was a couple of days where I just didn't check my Facebook. It didn't change the outcome of the election, and it made things a little easier for me. And so that's one thing I would encourage to consider. Social connections have never been more important, even if that seems weird over Zoom or FaceTime or whatever modality you like to use. But if you are one of those individuals that's forced to play a more conservative lifestyle and a mask is not enough protection and you're forced to be home more, making those social connections is really going to be relevant. And it can't just be your coworkers. Coworkers are hopefully people you enjoy and respect and work with, but it's got to be people outside of work too, that you can really address any aspect of your life, because some things are work appropriate and some are not. And I would also just say, connecting in your community, there's certainly a lot of need right now. And if you feel like you stratify as a CDC low risk individual and you wear masks and socially distance, there's still much that you can do to give back right now. So I would say for those that are frustrated by the things that have been taken away, take advantage of this time where you're not commuting, where you may have less meetings, and infuse exercise, sleep, hobby, rest, things that you can take control of. Take a moment to plan ahead of time. What would you do if you got sick or a spouse got sick? Who would watch your kids? And take control of what situations you really can, so you feel like you have a plan should you have to execute it.
That makes perfect sense. I even liked one that I think you mentioned, Chris, was that it's one of the big things that's important too is just to turn off, not even just Facebook or the news or what have you, but work email. We're in this kind of environment where work is just, a phone away at any given time. I think that's a really important point to be able to kind of separate work from social life and otherwise.
Yeah, and Scott, perfect example. And I'm going to take advantage of the fact that it looks like you're in a very beautiful home office, but I'm going to assume you're at home. And one of the things that I think a lot of the folks watching this webcast or a lot of folks in the working field right now understand is there's never been a harder time to separate work from home, because you're there. You suddenly both have merged to one spot. And I think where I used to be the type of individual where I'm going to stay at the office till it's done, so when I go home, I can guilt-free be dad and husband. And now you're home and you get that email or that text and you're like, well, I should really respond. You kind of have to set a definitive, it can wait till tomorrow day, and triage your work accordingly. then emergencies arise. But if it's not an emergency, let it wait to your next workday.
Sure. I couldn't agree more. Couldn't agree more. Well, I think it's a nice segue. You present great points on maintaining physical health, but I think so, and as you've pointed out too, so important within that mix is also the emotional health aspect. And especially now, it's like you said, maybe a lot of our social connections that we previously had are maybe not necessarily cut off, but augmented from what they previously were. And so for certain personality types or individuals, that could be a very taxing kind of event. Is there any kind of best practice or thought you have on maintaining good emotional health too?
Sure. Before I get to that, if you'll allow me some grace, I'm going to share some information because you really hit the nail on the head. CDC, in the middle of the summer, the end of June 24th through June 30th, sublet a survey, and it went out to about 10,000 eligible adults, and about 55% responded. So approximately 5,500 came back. And there were many follow-up surveys and studies as a result of this that were higher volume with more accuracy and precision. But the bottom line is they were surprised. They thought it might be so, but they were surprised that roughly 40% came back meeting diagnostic criteria of a mental health disorder or a borderline substance abuse disorder. And we already know there's pre-existing amount of mental health out in the community that needs to be addressed. We also know there's a certain baseline of substance misuse and abuse. But what we saw was a sharp spike. And we found the reality is that everyone had a way of coping with this pandemic. And for some people, the stress was so immense that it drove them into a state of never seen before depressive symptoms or never seen before anxiety issues that were now starting to interfere with their day or work life, as well as some people were still managing work and social actions, but then behind the scenes, increased alcohol consumption and other drugs of various natures, prescription or non-prescription. And so this kind of was no surprise, but it was validated and we looked into it more. And so how do you avoid that? And you can throw out all this science. And as an ER doctor, I love numbers and that's what I live by. But really, it came down to connecting with other people. It came down to connecting with other people and discussing problems, issues, good things, bad things. Suddenly, there was strain on family because you were with them all the time. And maybe your spouse no longer became the go-to person to talk to about because they or your kids or whatever might have been the major stressor of your life. Working from home with little kids is pretty daunting. That's 2 jobs in 1 week. And so what they found was people really had to reach out to either connections outside their house or connections outside their work and be able to vent and talk and be validated. And I think that a lot of people dealt with these problems and challenges in silence and just felt like they should continue to perform. Life took a 180 out of nowhere. No one asked for a worldwide pandemic. And so people had these additional stressors, and you can see the trap that they fell into. Over Zoom, all their coworkers looked fine. Over Zoom, production was still occurring. And I think a lot of people were hesitant to mention that this was hard. This was hard. This was difficult. And so what they found was people who were less likely to slip into these bouts of anxiety, depression, or substance abuse were well connected. And I don't mean from a business sense. Rather, I mean from a social sense that they had multiple individuals they could turn to vent. And so while I believe in exercise and sleep and eating well and all those factors that we strive to do, if I would push one thing to our listeners today, it's don't be afraid to pick up the phone and just talk. And I know that sounds oversimplified, but human contact has never been more important than when you're limited in a pandemic. And we see the results of that.
That's fascinating. It's probably something that I don't think I've ever heard that on the news, or it's not headline news by any means. So it's very interesting to hear that. And I think one of the things I would personally hope is that we talk all about the technology and adoption of video conferencing like this is probably an outcome from the pandemic, or maybe more work from home. But you have to also kind of hope that it's a lot more just better connection emotionally to whether it's family members or what have you, and maybe a bigger emphasis on mental health as well.
Yeah, I totally agree with you. And it's interesting, what spurred the adult research was pediatric research. There was actually an MMWR, which is Morbidity Mortality Weekly Report out of the CDC that recently came out in November, and it was a follow-up to what was done in the spring. But basically, it talked about the propensity or proportion of pediatric visits for anxiety and depression and how they were on the rise. Well, critics correctly said, hold it, if your number of ER visits in total are down, then that proportion of kids with anxiety and depression just seems falsely elevated. However, as people are no longer afraid to go to the hospital and we know more about the virus and ER visits are getting close to what they used to be pre-pandemic, we still see those same numbers on the rise. And when you talk to these kids, their innocence and forthright information really comes down to, why are you feeling this way? And the answer is, because I can't see my friends. And so it's amazing that we live this sophisticated, fast-paced adult lifestyle with so many things to consider. But the answer is best explained, in my opinion, by a 5-year-old, because I just need someone to talk to. And I just think it's amazing that we lose sight of that with all the data and fast pace of this current lifestyle.
Yeah. What is it, that book, Everything I Need to Know I Learned in Kindergarten? It's basically exactly back to that.
I really should have paid a lot more attention. Mrs. Meyer, if you're still out there, I'm sorry. I wish you'd been a better student.
We'll send her a note afterwards, but
right.
we appreciate her struggle regardless. Chris, I think it's a good segue. It's helpful to bring up, I think, different situations. So from your perspective, when you look at, whether it's a young family or a couple, a young couple, or an older retired couple, do you have kind of different thoughts on, how does the pandemic and the different lifestyle impact those people, whatever those scenarios may be? Any thoughts on that?
Yeah, I think that's a really smart question. There's a different implication of this pandemic depending on your age group. I mean, every life is different, but if you're going to stereotype age groups, I would think that young families starting out with younger children have a lot of stressors, in the sense that with school varying their learning mode depending on what part of the country you're in and what's going on. If your kids are not at school and you're forced to work from home, that's obviously a drop in productivity and a stress with job. A lot of folks worry about their ability to get a hold of adequate daycare during a pandemic. So there's a lot of stressors there. Also, people starting out earlier in their careers, the last thing they want to do is lose their job. There's a lot of uncertainty right now. So they're forced to compete and produce at a high level while still managing a 2-year-old in the house. And so my heart really goes out to that situation. And, I can't give a unique solution for that, other than, I think, discussing things with your coworkers and employer of, can we switch to more deadline driven work, where clearly I still need to produce and get things done, but my work hours may shift, if you're okay with that. When my kids are napping and sleeping, that's when I may be able to perform higher level work.
Right.
And I wish I could say that every employer is amenable to that, but at least having the conversation before you lose your mind might be a good alternative. Other things that we often think about when it comes down to that is retirees. So here they planned and set aside income and are excited to travel and do some of these really adventurous things, and now you're told you got to wait. And so I think that's really a difficult struggle. I've watched my own family and friends who are in that age group, try and reallocate their time. And I would actually humbly suggest that if there were projects and things that you ever wanted to do in community while need is on the rise, now might be the time to do that. And from a fiscal standpoint, you'd have far more knowledge, but maybe your 2 medium-sized trips that you were going to take in 2020 become that gigantic trip that you can now take in 2021, and you just kind of go all out. And so reallocating resources may not be a bad idea as you take your steady removal from an IRA or whatever you've planned for your retirement years. But certainly it's been a little bit challenging for folks in that regard. I would also say those that are living alone are most likely to be at a higher stress level. And that goes back to the communication and the ability to vent. Although we all joke, or at least I do, that sometimes the 2 beautiful girls in my life, my daughters, are the greatest gift. They're also my greatest challenge. But nevertheless, I have people in my home that I know love me and I love them and can communicate. And when you live alone, I think back to my time during my residency, that was just naturally harder because I was in a tiny apartment by myself in Chicago, and it's tough to feel connected. And then, I think for a lot of folks that maybe are close to retirement but not there yet, I often wonder what the pandemic does with that. The market was a little bit volatile in the last little bit. Clearly, you have more expertise in that area than I do, and job situations may not be as certain right now. And so, how do you proceed? Do you still ride out this corporation so you can hit that magic number of retirement? Do you take a chance in a job market that might be a little uncertain until the vaccine's distributed? And I don't have the answers for that, but I can see how it impacts us all at different points in our life.
Oh, there's no question. There's no question. And it's actually might be just for, Chris, if you grant me a little leeway on my end, a really short segue into more of the wealth topics for the short term, I think are great. And then we'll wrap up with really just overall best practices in the short term. But the really two big points I wanted to touch on for sure on when it pertains to wealth, and you hit the nail on the head. We're really just in a place of uncertainty. I think that's the biggest takeaway I've witnessed throughout the entire time frame. And when we talk about markets, that's really when we get into volatility as a result of uncertainty. Quite simply, we don't know what's going to happen. People get nervous. There's changes are made. We're not really sure what's going to happen. And so we think about things like an increase in cases or resulting in potentially shutdowns. Those have economic impacts that then could potentially impact the market in turn. We see economic numbers released. The largest one is probably unemployment. We've recently seen it tick up. It's ticked down in more recent months, and will likely continue to go up and down as we find some sort of equilibrium between normal life and kind of some of the restrictions and shutdowns and things like of that nature that we've seen in different states. Vaccine news is a huge one that's going to contribute to short-term volatility in markets. If Pfizer comes out and says, we're 90% effective, we had a 90% efficacy rate in our vaccine, markets are going to react accordingly. And the last one I think is important to be mindful of is stimulus expectations. I mean, I think a lot of people, Bill Griner's our chief economist, is expecting that when we have our new president take office, there's likely to be some sort of stimulus to follow. And markets are going to react to that as well, and likely, potentially positive, but if it doesn't meet expectations, maybe negative. All that to say that I think the important thing for investors and for individuals to be cognizant of is that, it's all part of a much longer term plan. And, all these short term market elements, are not necessarily a reason to make a change or, something falling down, or to react, or to freak out, if you will. That's pretty apt. So I think there's something just to be cognizant of and some elements to keep in mind. And the next one I'll touch on really quickly is just tax changes in general. This is a one we get questions on internally all the time. What's going to happen to my tax bracket moving forward? What are changes that are going to occur? Our belief is very simply that all things being equal, our expectation is that rates will likely go up. And so maybe taking advantage of rates in the present day can be helpful, i.e. filling brackets or doing things like converting pre-tax accounts into taxable or tax deferred accounts into Roth IRAs or things like that can be very helpful. There's also some estate planning changes that we potentially are foreseeing. So there may be action for higher net worth individuals moving assets out of their estate before the end of the year, I think is a good one to be cognizant of. And then Chris, you hit the nail on the head. It's a great time to give to a charity, whether it's for tax purposes or maybe even better, just for the emotional benefit it can bestow for you or your family and the great feeling of giving back. So the tax element of this is that basically 100% of cash donations are deductible for 2020 under the CARES Act. So something to be mindful of for public charities, I should say. Mm-hmm. So with all of that interjected, Chris, it would be really helpful for me, I think, and just for the audience in general, as we kind of end all the short-term aspect of things here. If you wouldn't maybe just provide, if you wouldn't mind, just maybe some just overall best practices. If you had 2 or 3, what would be kind of your really things to drive home and focus on?
I think in any crisis situation, and I think back to even just in a microcosm of the emergency room, I think this applies to a pandemic as well. And that is, you've always got a little more time to make a decision than you think. And so calm. My favorite saying is there are only 2 things that are contagious besides the virus: calm and panic. Let's be the first. And so you're going to deal with so many uncertainties in the next few years, or at least months, that taking the time to think through things methodically and being as calm as possible will go a long way. You can establish calm by pre-planning all those things that we talked about. what you would do if, regarding the short-term elements of the pandemic until you clear those hurdles. Having a plan in place is calming for a lot of individuals. The second one that I would strongly advocate is really staying socially and emotionally connected. The amount of things we have asked working class America to do and adapt to is daunting, and it really is pushing people to not just do their job, but find ways to navigate every other aspect of their life while they're doing their job. And so being connected with people that you rely on and trust and communicate with for question and answer, or just a simple venting session, goes a long way. And then the third thing that I would say is there's never been a greater time to focus on your personal health. We are all guilty of, my abuse product is caffeine, and I don't sleep as much as I should, and I should probably eat better, and I live by caffeine. But what I would tell you is there's never been a time to really just look at yourself, and because you want to be around for those golden years and those retirement years. And if you just started retirement and you had to put your plans on hold the past year, I can understand the frustration, but you want to have that opportunity to reallocate your money and travel the world and do the things you've always wanted to do. But you can't do any of those things if you're not healthy. And so it's not just dodging COVID. I think this is a wake-up call that all of us were forced to look at. There are certain genetic factors that we all deal with and live with that we cannot avoid or change. But of the things you can control, what are you doing right now to keep your health as best you can? And so staying connected, being able to vent, focusing on your personal health, and controlling the things you can control are all the things that I would advocate. And I think when you do those things, you are a little naturally more calm.
Oh, there's no question. Yeah. Just practicing mindfulness, being socially connected, all very relatively simple things on the surface. You're right. It's just taking the initiative to make it happen. I think at the end of the day, that's a perfect point. Yeah. Chris, one of the things, oh, go ahead. Sorry.
No, I'm sorry. I was going to say, and it's hard because, we're all watching, but hey, Scott, as capable as you are, and as much as I'd like to believe I do some things well, I'm not at Pfizer on the assembly line making the vaccine. So I can only control what I can control. Anyway, Absolutely. With that, I apologize. Go ahead.
No, not at all. Not at all. That's, I think that's the biggest element too, is just realizing the things we can and can't control, and being able to let go and understand that, whatever I can do within my little circle to make things better for myself and ideally for my loved ones and people I care about is so important, especially now. Sure. So Chris, one of the things, I wanted to kind of transition a little bit. I think that's a really good encapsulation of here in the short term, really good takeaways for things to be mindful of at the end of the day, right? I think it's just maybe even writing them down makes it easier to make sure that we're checking boxes and making those emotional and social connections. But one of the things I wanted to make sure we touched on too during this call, and I think especially for the kind of overlap of health and wealth, this one is probably even more important, is over the long term. We have a vaccine coming down the pipe. We're learning a lot about the disease, and I think my hope, my uneducated, unmedical opinion, is that at some point in the next few years, things will somewhat be back to some semblance of normalcy. And maybe I'm wrong, and so please correct me again if that is incorrect. But when we get to that point, retirement, as you so aptly put it, is just as much about maintaining a positive health, maintaining good health, as it is ensuring that you have the financial means to achieve the types of goals and live the type of lifestyle that you want to. So when you think about retirement in general, when you think about, rapidly increasing life expectancies over the last 50 years, are there big elements and things that you see people doing, or things that even you're thinking about doing now, in your youth, to make sure that you're like you said, your golden years are covered?
Sure. And silly for me to clarify, but do you mean from a financial or a health standpoint?
Oh, purely health.
Okay. Well, I feel a lot more qualified for that.
I'm sure you can cover either one.
I would tell you, this has been a little bit of a reality check. And one of the things that we dove into when we learned more about the virus was looking at certain risk factors that individuals had. And most of those were chronic diseases. Well, to no surprise, the better controlled an individual's chronic ailments, such as diabetes, hypertension, let me just focus on those, or even chronic lung disease, the better controlled it was, and the more optimized it was, the better we see these patients do. Now, that is a stark generalization, and there are one-off cases that dispute that, but for the most part, that remains true. And so what I would say is that it's not just COVID, but it's I want to be around to enjoy my children and grandchildren and to live retirement the way I imagine it. And for that to happen, managing chronic illnesses, whether that be as simple as I'd like to lose 15 pounds, or whether that's I really need to regain control of my blood sugar, or whether that's I literally don't do any cardiovascular exercise, so I'm going to start walking. We know that life expectancy at a later years is absolutely achievable, but that doesn't guarantee quality of life. And so, what I would tell you as a physician is that maintaining cardiovascular fitness, you don't have to be a professional athlete or anything close to it. Depending on your age group, you're just looking to get 80% of your max heart rate for a certain amount of time. And that's achievable through many activities, pickleball, jogging, walking, whatever you want to do. That's probably the most important thing. Dealing with your physician, primary care physician about all those preventative checklists that seem so annoying, so annoying. I can't go play tennis today because I got to get my blood drawn to check my stupid cholesterol. Please don't forget about your cholesterol for another 364 days until you have to get your stupid cholesterol drawn again. And so making those changes are really worth it. Now, also admitting to yourself that you can't be a perfect health specimen. And sometimes science and life have to both negotiate and meet in the middle. And so I understand, if I ate perfect, I would never enjoy a single meal. But looking at what's manageable and managing chronic disease or chronic risk factors is going to markedly increase your chance of having good quality of life in your elder years.
Yeah, that makes sense. I couldn't agree more. I think, from my perspective, when we think about kind of more of the financial elements or kind of the wealth aspect, if you will, is that, and Chris, you and I talked about this, is that paying for care is one of the biggest elements of anyone's, financial plan that we're going to put together for them. And the statistics get thrown around, but more or less, it seems like to me what I've seen is the baseline amount that someone can expect in retirement to pay for healthcare is roughly $260,000. That's not an insignificant amount of money. And I think the challenge too is that sometimes we're not really sure what things are going to cost. Just given our kind of the healthcare nature or the nature of our healthcare system, good or bad, however that may be. But navigating that, can be a big challenge, and not even just from a financial perspective, but a stress perspective in determining, how am I going to pay for these certain elements? What's the most efficient means to do that? How am I going to go about funding healthcare or health insurance if I retire early before Medicare kicks in? And so I think, within the same vein of what you're describing, it really is just taking the time to kind of plan and think through, 15 to 25 years down the line, where do I want to be, from a physical sense, from my emotional state, but also financially, to where I can do the things I want to do without having to worry about, can I pay for it, or is it going to be, a concern in that regard? There's a statistic I pulled from Vanguard. They do surveys all the time about asking people, when do you think you'll retire? And people always tend to say, I'll probably never retire, or I'll be 68, I'll be fine, I'll work forever. And what they find is that roughly that 40% of the people that retire early do so because of health reasons. And whether that's, they had an underlying condition that then became more chronic and or a bigger issue over time, or they were just confronted with some major health crisis, or if you will, that required them to change, what they were doing. I think the short, summary of this is we don't really know what's going to happen. And so controlling the things that we can today and making a plan over the long term can be immeasurably helpful, making sure that we have, we have something to prepare for all these unforeseen eventualities, if you will.
Yeah, and I think that's a really good point. And, along those lines, the irony of that situation is if you're driven into early retirement because of health reasons, then you take those pre-existing conditions and you might be pre-Medicare. And to cover those out of your own pocket, should you not have a spouse that still maintains insurance, can become very challenging. And so it goes back to, for financial and personal reasons, managing chronic ailments or risk factors to the best of your ability is not only a good health decision, it's a smart financial one.
Without question. I think, I just wanted to as we kind of wrap up ish, and if we have questions again, I would suggest anyone to submit them. By all means, we'd be happy to answer them. Um, we look at financial health, if you will. There's a few kind of key takeaways I think are important, and these are relatively basic. This is not rocket science, and I think our advisors tend to work with clients on all of these on a given time, any given time. But some sort of blend of how your assets are blended, if you will, or how they're allocated between different asset classes can be incredibly helpful, not only from just the amount of risk within those portfolios, or maybe cash or what else or what have you, but also from a tax perspective and ensuring that over the long term we're looking at the most tax efficient picture that we have, and we're funding ourselves in retirement. I think the best statistic I hear on retirement I've ever seen. Social Security has been around since 1935. When the program started, you turned 65 and you were eligible for payments from the fund. The average life expectancy in 1935 was 61 years of age. So really the average individual is never going to take it to begin with. And nowadays, our advisors sit down with clients, and it's, as they're nearing their 60s, it's one of the first conversations we're looking at is, what's going to be the best way for this to fund you for essentially the latter third of your life. So making sure that you have a proper allocation of cash flow, of assets, all those are so important. The next one I think is just, and I touched on it already, but it's just preparing for volatility and for uncertainty, for the unknown. Whether it's health conditions, Chris, like you mentioned, or it's financial things, if the roof caves in, or putting a child through college, or whatever the case may be. There are a lot of things that can be planned for in advance. To where not necessarily it's that specific item that you're addressing, 25 years in advance, but you're ready for it if that does occur. And I think the last one I think is just important is just mitigating risk, or making sure that we're taking the right risks. That's, I think, a conversation from, not only just an investment perspective, but just in life in general. Are we protected from a lot of the downside risk to protect the wealth that we've taken so much time to build up? In much the same way for your own health, you probably wouldn't jump off a bridge into a river. And now that I guess I'm older and smarter, probably wouldn't. So too do I think that a lot of clients that have worked so hard and so long and are nearing that retirement phase want to make sure that they're doing the right things to protect themselves from a lot of downside risk. Three big takeaways from my perspective on kind of on wealth health, if you will. Chris, is there any parting things that you wanted to make sure that we covered on the long-term aspect, or really just for our audience, kind of given where we are, you want to make sure they take away?
I would just say, a lot of the things that we find to be successful in the short term are going to be successful in the long term, in that maintaining a calm situation for decision making, always being able to network and socially connect, and furthermore, controlling those things that you can control. And as you said, both in financial planning and in terms of maintaining health and wellness, from a physical standpoint, you can only plan and anticipate and allocate what you've got in front of you for when situations happen. So I think from a healthcare standpoint, picking on myself, I have asthma and high cholesterol. So I'm going to work hard to manage both of those things, because they could impact my quality of life when I'm 70 and 80. From a financial standpoint, I work with my financial planner to also try and mitigate unreasonable risk and leave myself enough liquidity where if a disaster occurred, I can deal with it. And so I think it's kind of similar, controlling what you can control so you feel calm when the moment happens, and minimizing your risk so the chance of it becoming a problem is smaller every day.
For sure. As a fellow high cholesterol sufferer, I will sympathize with you on that important point.
After this.
Don't want to, yeah. We had a question actually come in, and I think it's a good one. Any suggestions on managing stress around acting on well thought out plans during a time of significant political, economic, and financial uncertainty? And I think you addressed a lot of them. But Chris, is there anything that there are, especially I guess post election, maybe some of the political discord is kind of quieted down, quote unquote. But in addition to the ones you mentioned, is there anything that really kind of strikes a chord with you, and maybe you're dealing with multiple elements, if you will?
Yeah, sure. So I think when you're feeling a lot of stress, identifying the source is probably the most important thing. And a lot of times people just make assumptions. Oh, well, it must be because I'm working late. Well, if you like your work, that's probably not the issue. Well, it must be I'm not sleeping enough. Well, it could be. Are you one of those people that becomes, abnormally deterrent in your personality if you don't get enough sleep? And so I think identifying the actual source. So I mentioned that just because there has been a lot of polarizing topics in 2020, right? And so a lot of people have felt anger, grief, frustration over those topics. But is it the topic, or is there something else that is the source and you're just lashing out as a result of something volatile in front of you? And so I would just say sitting down with yourself and really identifying the source of your stress is important. And then you want to say, well, what can I do to minimize my encounter with the source? If it's really truly your job, maybe now's the time to switch. And I know that's a lot harder said than done, or excuse me, harder done than said, but you understand the point. If it's a lifestyle change that's leading you to stress, then identifying that source and making the change is much easier than a job switch. But it's really identifying that source so you can make the correct change. Otherwise, you're just shuffling up the deck of life. And if you don't address the source, the stressor still remains. As far as stress reduction techniques, gosh, there's many. It's whatever works for you. It's quiet time alone, it's reading a book, it's meditation, it's taking that long run, it's whatever makes you feel happy. But I would say not only do you have something positive in your life to mitigate that stress, you've also got to identify the source to knock it out.
Sure. That makes total sense. One of the questions we got, this is an interesting one. I'll be interested to get your take on it. Do you have any comments or thoughts on the vaccine relative to a flu shot or something like that?
I only know about the vaccine as much as anyone else does and what's in the news. So what I will say, though, is I have a lot of confidence in the phase 3 trials that were done. I have a lot of confidence in the process. I realize this has been a very rapid undertaking by those in the Food and Drug Administration as well as the industry itself. But there's one telling fact that really makes me feel better when I think about the vaccine, and that is it is not going to be effective unless at least 70% of the United States gets immunized. And so people have to have faith in it and believe in it. And when you look at the thousands of individuals that have volunteered to go through this testing process and the trials itself, do I know the side effects we're going to get from it? No, I don't. But I think for the general population, they're not going to be significant. Do I expect there to be some sort of immune reaction? Absolutely. Just as we see with the flu shot, some people get fever and soreness. Some people don't even notice they had it. I expect that to occur just by the nature of the immune system itself. But do I know the particulars of what's going to happen? No, I don't. But the fact that we have 2 independent agencies between Pfizer and Moderna that have come through with an efficacious vaccine with about 95% effectiveness and the ability through our manufacturing to distribute it, I have a lot of faith. I have a lot of faith in the process. You go back to the swine flu, the 1970s, when there was a botched vaccine. I don't see the United States making that mistake again. There is a much more regimented process. There are many hoops to jump through. 2 independent companies have cleared those hoops and seems that they will be finalized. And the fact that both could achieve it, I really feel good about what's on the horizon.
Great to hear. That well put. One of the questions was, are you advising clients to change percentage of cash in portfolios? I don't necessarily know that there's a yes or no answer on that. Again, I think our perspective has always been it's highly contingent on clients' individual needs, individual situations. And that's a perfect question and a good conversation to have with an advisor as to what's going to be the proper allocation for whatever your individual needs might be. If I'm buying a house in a year, probably, yeah, I would probably not want to put a bunch of money, all that money I'd saved for down payment into the market. Or paying for college next year, same thing. But with longer time horizons, typically it makes less sense to be in cash, just in general. But good question.
Scott, I got a random question as a non-finance person. Do people tend to move more towards liquidity when they're nervous?
Yes. Although interestingly, the answer is generally yes. Interestingly, when we saw the very large correction in March, I think there was a statistic I saw that there was a large influx of individual investors moving into the market. as it declined, which runs counter to a lot of what behavioral finance preaches, which is typically when individuals get nervous, they'll go to cash immediately. And we know for a fact that is historically a very bad decision to make.
Right.
The challenge being you just never know when to get back in. And, typically what we find is when you see the market has done, 15% or 10% over a 10-year period, it's likely boils down to a few days, a couple dozen days within that, 1,000 or several hundred day time frame that dictated that return. And just getting in and out is not an efficient way to go about it. So to answer your question, yes, I think in general, people tend to want to do that, but it can be a very negative outcome, unfortunately.
Sure. Well, I appreciate you shedding that. You also helped me just lose a bet with my wife, so thank you.
She's a smart lady. I mean, clearly.
Yeah.
This is a good one. How does the pandemic of 2020 compare to 1919 financially and health-wise? Any lessons learned? I'm assuming that's the Spanish flu outbreak.
Absolutely. So the Spanish influenza of 1918 that rolled into 1919 had two waves. Without getting into all the epidemiologic details of it, it's very interesting that the most successful intervention back in 1918 is the one that you see the scientific community putting on a pedestal now, and that is masking and distance. Now, what we have that's much different nearly 100 years later is that our healthcare infrastructure, our ability to care for patients, and our complex medicine is far advanced. And that's why you're not seeing 58 million people succumb to a novel virus. It astounds me to think of that 58 million estimated individuals lost their life to the Spanish influenza around 1918. And you look at the lessons learned and the advancements of medicine, and we have so much ability now to take care of patients at a higher level. But yet in the general community, it still comes down, ironically, coincidentally, whatever the right literary term, to mask and distancing.
So simple. In terms of finance, I don't know that I have a great answer. I think, when we think about post that general time frame is World War I, and much like World War II, I think it's, as I recall, pretty significant economic boom times in the 20s, the Roaring 20s, as we kind of came out of World War I. But in terms of actual pandemic related to the actual markets or things like that, I actually don't have a great answer. But it's a great question. All right. Well, that I think kind of does it for our questions. Again, thank you all so much for taking the time to join us for this afternoon. And Chris, thank you so much for sitting down with us. I will personally say that you provided some really great insights, and I came away and learned a lot. This has been really helpful. Thank you for your time.
Well, it was a pleasure. I appreciate you inviting me, and I find the topic fascinating. It kind of comes to a natural point of interest when you're in the middle of a pandemic to talk about health and allocating your future, both financially and from a health perspective. So I think it was very timely. So thanks for the invite. And also, I appreciate you fielding my financial questions.
Well, whether the answer was good or not, glad you asked it, and glad we got some great questions from the audience as well. So to all those watching, we appreciate your time. Hope you and your families are staying safe, and if we don't see you, have a great holiday season. Thank you again, Chris.
Thank you.